Welcome back to our channel. Today, we're delving into an important topic that affects millions of people worldwide. We're going to explore what a heart murmur is, its symptoms, causes, and treatment options. Let's start. What is pulmonary valve stenosis? Pulmonary valve stenosis is a cardiovascular condition characterized by the narrowing of the pulmonary valve, which can lead to various symptoms and complications. Understanding the causes, symptoms, and treatment options for pulmonary valve stenosis is crucial for effective management and improved quality of life. Causes of pulmonary valve stenosis. The narrowing of the pulmonary valve can occur due to various factors, including congenital heart defects, rheumatic fever, and certain genetic disorders. Congenital heart defects are the most common cause, affecting the development of the pulmonary valve during fetal growth. Rheumatic fever, a complication of untreated strep throat, can lead to inflammation and damage to the heart valves, including the pulmonary valve. Additionally, rare genetic disorders such as Carney complex can contribute to the development of pulmonary valve stenosis. Symptoms of pulmonary valve stenosis. The symptoms of pulmonary valve stenosis can vary depending on the severity of the condition. Common symptoms include heart murmurs, chest pain, shortness of breath, fatigue, and fainting spells. Heart murmurs detected during a physical examination are often the first sign of pulmonary valve stenosis. Chest pain, especially during physical activity, can occur due to decreased blood flow to the heart muscle. Shortness of breath, fatigue, and fainting spells may also occur as the heart works harder to pump blood through the narrowed pulmonary valve. Diagnosis and evaluation. Diagnosing pulmonary valve stenosis typically involves a combination of medical history review, physical examination, and diagnostic tests. These tests may include echocardiography, electrocardiography, and cardiac catheterization. Echocardiography uses ultrasound imaging to assess the structure and function of the heart, while electrocardiography evaluates heart rhythm and electrical activity. Cardiac catheterization is an invasive procedure used to measure pressure within the heart chambers and blood vessels, providing valuable information about the severity of pulmonary valve stenosis. Treatment. Treatment for pulmonary valve stenosis depends on the severity of the condition and may include balloon valvuloplasty, surgical valve, repair, and medications. Balloon valvuloplasty is a minimally invasive procedure that involves widening the narrowed pulmonary valve using a balloon catheter. Surgical valve repair may be necessary in cases where balloon valvuloplasty is not effective or appropriate. Medications, such as blood thinners or medications to regulate heart rhythm, may be prescribed to manage symptoms and prevent complications. Living with pulmonary valve stenosis. Living with pulmonary valve stenosis may require ongoing medical care and lifestyle modifications. It is essential to follow up regularly with healthcare providers to monitor heart function and valve function. Adhering to prescribed medications and making lifestyle modifications, such as maintaining a healthy weight, regular exercise, and avoiding smoking, can help support overall heart health and improve quality of life.